What if you had to quit your favorite activity because it just hurt too much? A groundbreaking surgery in the Twin Cities will help millions suffering from chronic pain. For the first time in the Midwest, a neurostimulator that's MRI safe was implanted in a patient at Fairview Southdale Hospital in Edina. As our Joe Mason shows us, this new device could mean so much to so many.
His love for motorcycles goes back, way back, to that Steve McQueen movie, The Great Escape.
Of course, I don't jump. I'm too afraid to kill myself.
And Tim Soley had to fight back tears after he recently sold his bike.
I almost want to cry.
A slip and fall walking on ice gave him chronic back pain.
Well, having it taken away is like ripping out your soul.
Well, now Tim may be getting a new soul thanks to this new device.
This is something I'm hoping is going to work really well.
Tim, how you doing?
Tim is the first in the Midwest to undergo surgery for an MRI-safe neurostimulator implant.
For Tim, it's like an early Christmas present right over the back of the spinal cord.
Dr. Andrew Will, medical director at Twin Cities Pain Clinic, says this new Medtronic device will most importantly eliminate chronic pain, but allow Tim to have a body MRI scan for any reason down the road.
The metal is different.
Before, patients with a metal implant couldn't have an MRI because the device creates a magnetic field.
What we're hoping to look forward to is that over time people will not have their hands tied by the limitations of the medical device, that they can actually have the treatment they need and not worry about whether or not it limits their future care.
Tim Soley hopes the surgery gets rid of his chronic pain and brings back his soul, that soul being a new or used motorcycle.
Pawn shop out in Forest Lake has a Honda Shadow for sale. It was pretty cheap.
Maybe he can find a bike like Steve McQueen's. Joe Mason, 5 Eyewitness News.
I sure hope he gets back on that bike. The long-term hope is that all devices could be made with a material that would allow patients to have MRIs. And as many of you know, chronic pain is a chronic problem for your bank account. The annual cost of health care in the U.S. due to pain ranges from $560 to $635 billion. That combines the medical costs like doctor visits, MRIs, and pain meds, and the economic costs related to disability days, lost wages, and productivity. Low back pain is the most common, followed by severe headache or migraine pain, neck pain, and facial pain. Just know that you are not alone. Pain affects more Americans than diabetes, heart disease, and cancer combined. This chart shows that clearly. 100 million Americans suffer from chronic pain.